Hello, addictions class. This is the presentation on prevention from chapter 16. My name is Pauley, and Ninoska Tamayo also helped contributing to this presentation by adding the methodology, results, discussion, limitations from the study we've researched. That's from the chapter 16. So our presentation is pretty much about drug prevention programs that are being used in schools today. The most popular one you may have heard of is the Drug Abuse Resistance Education Program, also known as D.A.R.E. The book stated that approximately 3/4 of the school systems in the United States have embraced the Drug Abuse Resistance Education Program, making it by far the most popular program in the nation. You can find that on page 432, where they go on to add in more information on D.A.R.E. And this begs the question, do these programs work? Do we know if they're effective in reducing drug abuse when you become an adult? So several studies have been cited from the book saying the ineffectiveness of D.A.R.E. D.A.R.E.'s short-term effectiveness for reducing or preventing drug abuse behaviors is small, by et al. 1994. Subsequent reports have provided a similar indication based on the studies of Botvin and Griffin 2003 and West and O'Neill in 2004. And a 10-year longitudinal study found that students who had participated in D.A.R.E. while in 6th grade did not have more successful outcomes than students not exposed to D.A.R.E. by Lynham et al. 1999. So what does work? What prevention programs are effective in limiting substance abuse in our youth? One program that was mentioned in the book is life skills training. It was developed by Gilbert Botvin of Cornell University Medical College. We just heard that name mentioned about how D.A.R.E. prevention programs have been ineffective. So he developed his own prevention program to help target our youth. It focuses on building students' drug resistance abilities by helping them cope better with life's pressures. It keys on skills for being independent, gaining personal control, communicating effectively, relieving anxiety, overcoming shyness, and developing healthy friendships. The primary goal is to promote skill development, which includes social resistance, self-management, general social skills, and to provide a knowledge base concerning the avoidance of substance use. Life skills training is a universal preventive intervention program based on social learning theory and problem behavior theory. The program has been found to curtail students' use of a variety of substances, including alcohol, cigarettes, and marijuana, from the study Spoth et al., which is our main study that we're going to be presenting. The study also involves a Strengthening Families program, which one of the experimental conditions involves both the life skills training and Strengthening Families program. So SFP is a 14-session evidence-based parenting skills, children's social skills, and family life skills training program specifically designed for high-risk families. Parents and children participate in SFP both separately and together. The long-range goal is to reduce youth substance use and other problem behaviors. Intermediate goals include the enhancement of parental skills in nurturing, limit setting, and communication. So this is important just for the overall dynamic of families and family structure and how to talk about substance abuse. So Spoth used both those programs to conduct an experiment using both experimental and longitudinal designs by gathering data repeatedly throughout the 5.5 years from baseline of this study. And it's experimental because he tested 3 variables, one of which is in control. Two of the variables involve L.S.T and LFP, or SFP, sorry. So the hypothesis he developed from his study is ninth grade students in both intervention conditions, which those intervention conditions are what I just mentioned, those receiving the 15-session classroom-based L.S.T. plus the 7-session S.F.P., which 10 to 14-year-olds and those receiving the L.S.T. only. The hypothesis pretty much states that both the intervention conditions would demonstrate significantly lower substance initiation than the control condition. The control condition is pretty much leaflets on teen development mailed to parents. So pretty much like pamphlets you get in the mail or see in a school's nurse office or health office. And the control condition was measured by students at 1.5 years and 2.5 years past baseline. So the methods of this study was a total of 1,677 participants and their parents enrolled in 36 rural Midwestern schools recruited from a regional pool of 43 schools, all middle school grades 6th through 8th grade. They were followed for 5.5 years. At recruitment, schools did not know their experimental assignment, which was guided by a randomized design. The measure of the study was self-reported substance use, and it was obtained from the classroom-administered questionnaire. Approximately 20% of all students in the study were in the higher risk subgroup, which is defined as those students who reported use of at least two of the three substances, which include alcohol, cigarettes, and marijuana. 22% of the students were in both intervention conditions, and 15% of students were in the control condition, leaving the rest to the L.S.T. condition. The results of the study found that the prevention trial follow-up assessment 5.5 years after baseline indicated positive outcomes for 12th graders on all substance initiation measures, which are alcohol, cigarettes, and marijuana, for one or both of the interventions. So the results pretty much say that both experimental conditions worked. It reduced substance initiation measures in alcohol, cigarettes, and marijuana, and the control group was less effective in limiting those initiation measures for substance abuse. Positive outcomes on more serious or problematic use were shown for higher risk subsamples. So it just shows that the subsamples where they've used two or more of the substances already at baseline, it showed that the L.S.T. Experimental condition or the L.S.T. plus S.F.P. experimental condition were both effective in reducing their substance use. There are limitations for the study. It was generalized by predominantly white residents of small Midwestern communities and towns, so you'd imagine that these results can't be applied to minority groups or people of other categories and other areas where they live. Also, the study is limited by the data that gathered was self-reported data, so it has reliability and validity issues. You do not know if those participants are telling the truth or if their data is completely accurate. It's based on their own perception. So my research paper was based on the do school drug prevention programs work? And I did a lot of reading based on Project Alert and Social Influence Program. So those programs, I'll start with Project Alert, which is Adolescent Learning Experiences, Resistance, and Training, a 2-year classroom-based substance use prevention curriculum implemented in middle school programs that target cigarette, alcohol, marijuana, and inhalant use. It's a popular evidence-based program among middle schools. A lot of studies I've researched showed positive numbers saying that students who went through Project Alert, they have reduced their substance use in their life. And one of those studies was a 22 longitudinal study Granted, it was in Denmark, but it just shows like how long these studies or how much of an impact these programs have, and how much money they could save our economy for rehabilitation and lower medical costs and other expenses that our taxes are used to help people with addiction or other conditions brought about by drug use. What I found that was really interesting was a social influence program. It emphasizes skills for resisting peer and other social pressures contributing to drug abuse. It involves a pharmacist, a police officer, and a teacher cooperating together, performing their roles according to their respective fields of specialty, and students moderated role-play simulations in which representative students and teachers showed how to refuse drugs. This is all based on social learning theory, so these students pretty much see how you pretty much learn how to say no to drugs, and that study showed really great positive outcomes compared to the control condition in the experimental study that researched in my paper. So there's some discussion questions I want to ask you, and feel free to post on the discussion board or comments, or let me or Ninoska know personally how you feel. So I want to ask, did you participate in a prevention intervention program such as D.A.R.E, L.S.T, or anything similar while you were in grade school? And if so, do you think it helped? So many of us probably went through D.A.R.E. It was definitely popular in the 90s, and most of us are born in the 90s. So just let us know if you think those programs are effective, or if you found a more effective program. And another question I think is worth asking is, do you believe prevention programs should still focus on marijuana use over other drugs such as heroin or meth? Because you feel like those are more problematic drugs. Addiction's really on the rise, and it's targeting college students now, no longer like poor minority groups. And also, Dr. Caesar mentioned how a lot of addicts, they tried marijuana, or the argument that marijuana is a gateway drug, like a lot of addicts have used marijuana, but a lot of marijuana users haven't used heroin or meth or any other drug that's way more harmful to them. So if you believe they should still target marijuana as a substance that schools should be worried about, just post into the discussion and tell us how you feel. And we'll try to respond promptly and accordingly. So thank you for watching our video. Here's our references in case you're interested in following up with any of these studies. And we appreciate your time.